So in this video, I'm going to be talking about the second part of the laser light therapy, um, answering the following questions. The first question is, in your own words, explain the impact of laser on the inflammatory and healing process. So the way that the impact that laser has on the inflammatory and healing process, the first thing is that it increases the ATP production, right? But by having that increase of ATP production, it also provides vasodilation. Having vasodilation means that it will be an increase of blood flow. Having an increase of blood flow will have an impact, will have an increase of cell metabolism, which is going to be providing more oxygen and nutrients into the area. Having more nutrients means that the more chemical mediators are going to be able to pass into the area, like histamine and phagocytosis. Especially phagocytosis, there's an accelerated rate of phagocytosis in the inner area when you're applying laser, which phagocytosis helps. That is going to be the fight of the white cells fighting of the dead cells to be able to heal that process faster. Also, in that healing process, it provides an increase of collagen. Uh, but having that increase, it means that the tissue is going to be able to heal way more faster, and the things that can be able to help out with that will be the chemical mediators of phagocytosis. And then the second question, in your own words, explain the impact of laser on pain. So laser, the impact that it has on pain has kind of like the two ways. It can be able to help out releasing, having an accelerated rate of the nerve endings. Uh, by having that increase of the nerve endings, not increase, decrease of the nerve endings, is because they will have, it will be able to help out with the decrease of inflammation. So it's gonna help out decreasing that those nerve endings, the pressure that they have. And also, if you're applying kind of like a low-level laser, and low level laser intensity, it will be able to help out through the ascending beta, because it's going to be affecting the sensory level of pain, which is going to be increasing the ascending beta pain receptors, right? With a lower level intensity, it impacts on the sensory level, ascending the A beta, and kind of like a little bit more, slightly higher intensity with laser. It also gonna be able to have a release of the opiate release, which is going to be blocking that. Which the opiates release are going to be blocking those nociceptors that are going to be the pain receptors, right? Like A delta and the C fibers. So has two ways of that can be able to impact on pain. The first one, with a level intensity, it will be through the sensory levels, ascending A beta, and kind of like slightly higher intensity of laser. It will be with the release of the opiates and endorphins, which are going to be the blockage of the nociceptors, so the nociceptor does not pass through to the brain. So that will be the way that the laser is gonna be having the impact on pain.